Your facelift recovery journey. Welcome back to the Chopra Plastic Surgery YouTube channel. I'm Dr. Karan Chopra. Today I want to walk you through something that every facelift patient asks, which is what should I expect after surgery? Now the nurse definitely covers it, but I also want to cover it and go step by step, starting immediately after the procedure, the first night, first week, first month, and beyond. So the goal here is really to give you a clear roadmap so you feel comfortable and confident and supported every step of the way. Immediately after surgery, once the facelift is complete, you'll wake up, we'll take you to the private recovery suite. One of our highly trained caretakers will be right by your side overnight for the first night, checking vital signs, keeping you comfortable, and making sure you're doing well and you're feeling alert. That first night is really about just safety and rest. Many patients do choose to use that overnight caretaker service and the overnight accommodations for that first night. I think it's a great idea. You might have a snug wrap around your head. This is something we do occasionally depending on the surgery, and if I think I need a little extra support over that first night, but using it too long can kind of trap in the swelling. I'm using this less and less frequently in the modern facelift because the contours are created by the surgery and not by the wrap. So if you want one for comfort, we can get you one, but usually I prefer to only use it if needed. Most patients are going to feel tightness and not pain, but of course we do prescribe you some medications just in case you need them. And don't try to be a hero that first night. Take the pain meds if you need them. I tried to tough it out with my own ankle surgery, but eventually I ended up taking it so that I could rest and recover properly. When you're in pain, your whole body's in fight or flight mode, which isn't good for healing. I also do want you to keep your head elevated. This really helps reduce swelling and helps you heal up beautifully, but you don't need to sleep in a chair or a recliner. Just 1 or 2 extra pillows is usually more than enough. First morning. So now this is exciting. The very next morning, the caretaker will help you shower. They'll put on Aquaphor on your incision, brush your hair friendly, and I'll see you at the office if you didn't have an overnight caretaker. Otherwise, I'll usually see you within 2 to 3 days. So if you had a Friday surgery, I'll see you on Monday. If you had a Thursday surgery, I'll see you on Friday. This is one of my favorite moments because you and I both kind of get a first glimpse of your results. And even with some swelling, you're already noticing a more defined jawline, youthful contours, and usually there's smiles all around. So at this stage, the nurse will kind of review your incisions. When we see you at that visit, we'll review your incisions, help you take care of the drain, the incisions, and answer any questions that you have at that point. And this day is really just for rest. Keep a bland diet, so no spicy, tangy food. High protein, high calorie is key. So salads don't really have enough calories and soups are too salty. So stock up on protein shakes, avocado, eggs, things like that. Now we're on the first week. During the first week, recovery is about rest, gentle walking, incision care, and avoiding the sun. I really do want you to walk. It helps you support circulation, preventing complications associated to your lungs settling, called atelectasis, and also blood clots in your legs. I want you to clean your incisions with mild soap and water, keep them moist with medical grade ointment like Aquaphor, and do that daily. This step really helps your skin heal a lot better. Scars tend to fade better when they're not covered with scabs, so we really don't want scabs on that incision. Keep it clean, but don't disrupt those delicate sutures. And guys, please, don't clean where you can't see and don't touch your earlobes. It really cringes me when patients are touching their earlobes, so don't do that. Now, lymphatic massages are something that patients tend to do 1 or 2 times a week for a few weeks to help reduce swelling more quickly, but it is an additional investment, so if you're not comfortable with that, it's totally fine if you skip it. It's just best for patients who kind of want to recover a little faster. On day 7, we'll typically see you back at the office, check your sutures. If you're from out of town, this is usually the day you're safe to fly back. You're still going to be a little swollen, but things are heading in the right direction. But no scar creams yet. Let's wait till about the 2nd week to start that. So now we're cruising along in the first month. By 2 weeks, many patients feel ready to see friends. Bruising is usually minimal, swelling is reduced, and that confidence is really coming back. Patients are sending us selfies and really just we're all feeling the vibe. Now at 1 month, that's typically 4 to 6 weeks where you and I will want to do a little virtual, check on things, make sure things are going well. But throughout the whole process, you can always text me, reach out, let me know if you have any questions. And that 3 to 4 week is really a beautiful time in the facelift healing. This is where patients are sending us messages saying they feel 10 to 15 years younger. The results look natural, never overdone, and it's really the best part about my job. Sure, you might still be feeling some numbness and tingling. That's just your nerves waking up, and that numbness is going to improve week over week in this direction. So the nerves travel like this, so the numbness will fade and this will recover last. So just remember that. And now swelling under the chin, that's the last part to recover. I don't know how to make it go away any faster, but it's because swelling and bruising follow gravity, so the neck will feel a little firm the longest, but typically it doesn't look swollen, it just feels swollen. 3 to 6 months. Now you're 3 to 6 months out. Your results are really starting to take shape. Scars are going to soften and fade. Sensation will return. Your face is going to start to feel more supple and natural again. And just because it feels soft again doesn't mean it's a failure or that we didn't over pull or that we didn't pull enough. We pull as hard as we can to reset your biological limit, but we can't over pull it, otherwise you're going to have flat contours and it's not going to look right and your scars scars will be thick. So enjoy the relaxation and the return of the supple skin at this phase. And it's that 3 to 6 month time where patients tell us that they can't even remember what they looked like before. Well, don't worry. If you don't remember, I have your before photos. And, more seriously, during this phase, sun protection and skincare are super, super important. You want to protect your investment. If you're not using a retinol, a vitamin C, a proper face wash, proper sunscreen, call my nurses, have them ship it to you. It really makes a difference. Oh, by the way, if you're not following us, please hit the subscribe button, like it, comment. I'd really appreciate it. And the reason I bring up that skincare and protecting the investment at this phase of healing is because now you can't use skincare and Botox to replace a facelift, but proper medical grade skincare, avoiding weight fluctuations, and occasional use of Botox, not necessarily filler, but definitely Botox, and microneedling can actually help preserve the results. When people use it in the other direction to avoid a facelift, that's where it ends up being kind of a waste of money and also makes you look unnatural because you're super smooth, but you're still saggy. To me, that looks more unnatural than someone who's nice and tight and cleaned up and still has a few wrinkles. So it's not mandatory, but many patients do choose to do that, and I can help you if you want. All right, so 1 year and beyond. Now, this is a really nice time. It's about a year out. You're fully healed. You're looking good, feeling good. Scars are fairly undetectable and they're final. And your results should look refreshed, natural. They're going to last you a really long time. And so at this stage, the focus is going to shift more into that maintenance phase. We're going to want to help you to age more gracefully, non-surgical treatments, and protecting those beautiful results like we said earlier. And this includes Botox, microneedling, proper skincare, red light therapy. All these little things do add up. Some common questions. Let's kind of transition to some common questions we get from patients. So when can I exercise? Light walking should start the day after surgery, but please no strenuous workouts for 4 to 6 weeks. No matter how many times you ask me, the answer is going to be the same. You can start to get back to exercise at 4 to 6 weeks. At 6 weeks, you can't ruin the results. Till then, it is very delicate. When can I return to work? If you work virtually, like on a computer or on a phone, you could literally return in 2 or 3 days. But if you need to see people, if you need to go into the office, client-facing roles, then just wait. I would recommend waiting 12 to 14 days. That way you're confident. For in-person work, plan for 2 weeks. By 1 month, almost everybody feels socially confident and comfortable. Why does recovery look different for every patient? Well, every patient's unique. They select different procedures, genetics, nutrition, lifestyle, hormones. I've noticed patients who are on hormones do have a different recovery pathway, typically better than others. And some patients, they look amazing in 1 week. Other patients take a little longer, but no matter how long the journey takes, everybody does end up looking great once they fully healed. They all get that natural, youthful, and long-lasting transformation. Try not to compare yourself to people on the Instagram, or if you're getting surgery with your spouse or your friend, you may have different timelines. Usually the guys are in a little bit more pain than the ladies, but they all end up doing great. It's really important to kind of optimize yourself before surgery. I really like patients to take Heal Fast supplements. You can get them on Amazon. Want you to get some arnica and bromelain, have a high protein diet leading up to surgery, and of course the lymphatic massages, red light therapy, all those play a role in quick recovery. I hope you enjoyed the video. I really enjoyed creating this video. It's an opportunity to kind of convey some things to upcoming patients. And recovery is really, it is a journey. And it's also one of the most rewarding experiences that you can go through because you're doing this for yourself. You're trusting me with your care, and I don't take that lightly. I'm going to do everything I can to make sure you have a beautiful surgical result, and that healing is something that is a partnership. And of course, Mother Nature has the final word. But my goal is that you look not only younger, but you feel cared for at every step of the way. So while you're recovering, if you ever need anything, please text my office. If you need to speak with me, let them know you have a concern you need help with. And if you're planning a facelift or you just want to learn more about facial rejuvenation, please, like I said before, subscribe, share this video with a friend who might be having a surgery coming up with another surgeon. Once again, I'm Dr. Karan Chopra. Thank you for watching, and I really look forward to guiding you through your own journey beyond the surface.